Passive range holds are going to be a great exercise to train and close the gap between your active and passive range of motion, but also it's a great assessment tool to see how much of your passive range of motion you have control of. So for this exercise, we're gonna work on hip flexion, which is this movement. You're going to make sure that you can have a wall or a stick or something to balance with, because we're doing a lot of standing on one leg. So your ability to really get the most out of this exercise is going to require you to have really good stability on that leg. So use something for a little bit of support. To execute the exercise, you are going to, if we're gonna do our left leg, hug your left knee into your chest, making sure that we are very vertical and our stance leg is nice and locked and long. What we don't want to do is come down here and come into this position. We want to make sure that we stay really tall so that we are really only training the joint that we are training, the tissues we're training, which is gonna be the hip flexors or the hip joint of the left leg for me today. So grab that, pull your knee into your chest, slowly contract those muscles, try to hug your knee into your chest as much as you can, slowly let go, try to drop as little as possible, hold for the prescribed amount of seconds, and then reset with another rep by grabbing your knee into your chest again and slowly releasing, trying to hold the position. A lot of people when they do this might notice a significant fall. That's okay. I just want you to control it. So if it's falling as you are performing this exercise, it's gonna fall. Just try to let it fall as little as possible and try to make sure you're doing so without leaning or compensating the rest of your body. That way we really get the most out of this exercise. The other thing to note is if you feel some closing angle front of the hip sensations, we want to avoid those. So play around with maybe tucking your pelvis, bringing that rib cage down a little bit. If that helps, cool. If it doesn't, this exercise is just not a good one for you. Defer it at this time. It's not going to benefit you to push into that. The last thing I want you to note is as you're doing this, please avoid flaring your rib cage and extending through your spine. That is going to be a common compensation. Instead, we want to keep that rib cage down and still stay tall. I know those sound like they're contradicting, but they're really important because that makes sure that we are not compensating at our back when we're working on our hips. So grab your knee into your chest, hug it, slowly release, try to let it move as little as possible or keep it high, reset, and perform for the prescribed amount of reps for the prescribed amount of time. And as you do this on a week-to-week basis, you should be able to add reps, add time, or just see your leg fall a little bit less and less. That's how you know you'll be making progress.